Hello, my name is Brian Sykes, and I am a sonography student in my last semester here at LCC. This video is on a new technology of ultrasound called therapeutic ultrasound, or also known as high-intensity focused ultrasound. The research of this technology has a very wide range of applications like tissue healing, micromassaging, treating inflammation, tremors, hemostasis, and targeted drug delivery. However, this video mainly focuses on its application to treat solid masses that has a longer history of research. To give an overview, therapeutic ultrasound is a minimally invasive procedure that uses ultrasound waves to target pathology in the body and destroy the cells. This treatment can be used on certain solid malignant and benign tumors in many areas of the body. However, high-intensity focused ultrasound cannot be used for all tumors. If the tumor contains dense calcifications, the sound waves can be reflected and interact with nearby structures. How does it work? Well, to start, I think it's important to distinguish between ultrasound imaging and high-intensity focused ultrasound and their goals. Ultrasound imaging uses high-frequency sound waves ranging above 20,000 Hz to create real-time images. The sound waves are sent into the body and reflected back to the transducer. The transducer creates an image on screen depending on the speed of these returning sound waves. There are very small bioeffect mechanisms from ultrasound imaging and are always limited and monitored in real time, called mechanical and thermal index. The goal of high-intensity focused ultrasound is increasing this thermal bioeffect in the target spot of the pathology. The high-intensity sound waves increase the temperature of the target by causing the cells to vibrate, converting the energy into heat while unaffecting the surrounding tissue. A great analogy of this technology is using a magnifying glass to focus sun rays in one location. What does this look like for the future of ultrasound? High-intensity focused ultrasound therapy is an emerging therapeutic modality that is still being researched to resolve its current drawbacks. Prostate cancer has the longest history of clinical use. The results from early-stage cancer have been comparable to surgery in terms of local control, disease-free survival, and complication rates. I believe therapeutic ultrasound will continue to be used in areas that have a longer history of promising studies, like patients with early-stage prostate and pancreatic cancer. It may be too early to accurately predict the future of high-intensity focused ultrasound. However, I believe we will see a lot more progress and research in the near future due to its non-invasiveness and sharp treatment margins, leading to treatments with very low complication rates. It is possible we will see a new specialty in the field of interventional oncology that uses high-intensity focused ultrasound. I chose this topic because I've always had an interest in the treatment portion of patient care. Oftentimes in ultrasound, we find pathology and are detached from the medical care. So it would be cool if ultrasound could find another area to become involved in the treatment portion of patient care. This new research makes me feel proud of the field of sonography, knowing it will always be changing and I will always be learning. Ultrasound is already involved in guiding interventional radiology procedures with the goal to safely and accurately collect cells for diagnosis. Similar to these procedures that are regularly used today, I would imagine high-intensity focused ultrasound could become the standard used by radiologists and sonographers to treat patients someday. These are the references I used for this video. Feel free to look into the sources I provided on high-intensity focused ultrasound and comment your ideas on the topic below. Thank you all for listening. Have a great rest of your day.